For the last 20 years, we've been leading the way in providing direct services related to preventative health. Today, Beach Cities Health District provides more than 30 evidence-based wellness and healthy living programs and services for residents of all ages where they live, work, learn, and play. As a public agency, our annual operating budget is funded through property taxes paid by Hermosa Beach, Manhattan Beach, and Redondo Beach residents. Tax dollars only fund about 25% of the annual operating budget. The other 75% is generated through a mix of private revenue sources that include limited partnerships, investments, and leases. This model affords Beach Cities Health Districts the financial flexibility to maximize tax dollars' return on investment by providing nearly $4 in community services for every tax dollar received. So this responsible funding structure and our ability to poll and survey and really find out what the needs are of our community by doing needs assessment really allows us to specifically target our direct services and programs towards the needs of our community. So for example, we have the Live Well Kids program in Redondo Beach, where we were seeing high levels of obesity among the children there. We were able to come in and develop specific programs through our partnerships with the schools that addressed nutrition and exercise to address the obesity we were seeing, and we saw a significant reduction over 10 years.
What I think makes our school district special, and having been in this business over 30 years, I can say this with conviction, is that we have the Beach Cities Health District. No other community has an organization so focused on our students' health and integrated into the very fabric of our programmatic pieces, the educational academic pieces.
I really think the program is important because a lot of kids don't really know where does food come from. They go to the grocery store, they might see it on their plate when their moms fix it, but it's really opened their eyes to seeing it from start to finish. I've had parents come up to me and say, "Oh my gosh, you're the garden docent. Oh my gosh, my kid eats vegetables now," and they hug me. I'm crying, sorry. And it's the most extraordinary experience to introduce something new to somebody and see it come to fruition, and then want to see you again in the garden. This program through our school district is amazing because it's supported by the Beach Cities Health District, and they're the ones that are behind everything that goes on. And if they weren't here, then I don't think these programs would exist.
Because we're a small organization, we really need the help of the volunteers to provide all the services that we give to the community. Volunteers really make up the backbone of Beach Cities Health District and expand our reach and services to residents. More than 1,000 volunteers help run our programs and services, providing nearly $1 million in services. We know people who volunteer also experience greater life satisfaction and well-being. Like many other communities in the United States, we have an expanding population of older adults. And so to address that health need, we have a community services department, and they provide direct services to over 430 older adults. And that ranges from in-home care to helping them reduce the risk of falling, to nutrition, Live Well programs, and also bringing in our volunteers as companions and people to not only spend time with them, but run errands for them.
So Drew and I, we do a lot of different exercises when I come each week. And a lot of these exercises mimic daily activities of daily living.
I'm not just an old guy sitting in the house anymore. I have people come, I have people that I go to, things I do. It's been a wonderful thing for me.
Hi, I'm Dr. Bill Kim. I'm the Chief Medical Advisor at Beach Cities Health District. I oversee all the programs and services we offer at Beach Cities Health District, as well as our Center for Health and Fitness. We also have a medical advisory board that oversees all of our programming. The board is made up of local seasoned physicians from various specialties such as emergency medicine, orthopedics, cardiology, as well as oncology. Today, the median age of our members is 62, and more than 3,000 members of all ages and ability levels take advantage of medically based programs. What makes the Center for Health and Fitness truly special is its community atmosphere.
Longtime member Michael Thomas joined with the goal of shedding weight off his nearly 400-pound frame. His personal physician recommended surgery, but Michael was determined to lose weight through nutrition and exercise. Since becoming a member, Michael has made significant progress, He has lost more than 100 pounds and has improved his balance, agility, and overall mobility. This is Michael.
But I just like the gym. I've been getting stronger. That's the thing I like. It's not necessarily weight loss is what I want to, but I see I'm getting stronger. Things that used to be harder for me are easier. You know, I'm getting stronger. Legs are stronger. Things that now, when we first started, things that were workout now are warm-ups, you know, as we go. And Derek is pushing you all around, just changing it up, which is good too. I had to walk with a cane for a while. And so as I got that, as I worked with him, my legs got stronger. I get rid of the cane, so now that's not an issue. So I have the cane there, but it just sits there. I haven't used it in the last 2-3 years, you know. So that's good. That's the good thing about it. I tell them the hardest part for me about the gym is just coming in here. You know, coming in. Once I get in, I'm okay. But it's like, oh, do I have to do that today? Something like that. But I tell everybody that's the hardest part. Once you get here, now once I get warmed up, I'm okay. I can go through my workout, go through everything, and then at the end, once I'm finished, I feel good. That's the motivation. I want to basically live a lifestyle and keep healthy, get healthier for my family and for me too. So my motivation is just for me to get better.
Beach Cities Health District brought the Blue Zones project to the community in 2010 to specifically address the health needs of the adult population. It uses permanent, evidence-based environmental and policy changes and works with local schools, workplaces, restaurants, businesses, and city governments to make the healthy choice the easy choice. As a result, we've seen the number of obese residents come in at less than half the national average. Smoking declined more than 17%, and daily significant stress dropped by nearly 10%. Thank you for watching our video. We hope that we've demonstrated how preventative health can really improve not only the health of the community, but build health among the community members so that everybody's taking care of each other, keeping them out of the hospital, and improving our health.